Hi everybody, I'm Dr. Jonathan. I'm a dentist here at Our Dental Care. Today I'm going to be talking to everybody about dental tooth replacement options. So maybe you've just recently lost a tooth or you've had a gap for a while and you're wondering what your options are available to you. I'm going to go through all four of your options, starting with the most inferior and finishing with the most superior option. So sometimes you might choose to leave the gap alone. This is definitely an option available to us, but there are definitely some downsides with that option. If you have a missing front tooth, what can happen is that it'll be very noticeable when you're talking and smiling, and it can also affect your speech. If you have a missing back tooth, you might not see it, but what it can do is that it'll affect your chewing ability, and the forces when you bite together can cause the other teeth to crack and fracture. And the force with when you're eating and biting will be distributed among the remaining teeth, and it can cause the teeth to crack and fracture, but also potentially wearing away. So another downside of losing a tooth is that when you lose a tooth, the teeth on either side can tilt into that position to try to close that gap. But what happens is that it makes an area that's difficult to clean, and then it can start affecting other teeth and may cause them to be lost in the future as well. If you want to correct that, it can require expensive orthodontic treatment to try to push the teeth back into space and open up the space so we can put either an implant, a bridge, or a denture in place. So when you lose a tooth, what happens is that there will be a gap in between the two teeth, and there will be a bone that will be there. Over time, this bone can deteriorate and shrink away if there's no tooth or implant to hold it in place. Sometimes if there's too much bone that's lost, then it can prevent you getting an implant in the future. So one of the most economical options we have available to us is the denture. The denture can be plastic or both a combination of plastic and metal. It is a removable teeth that you take out and you can put back in. The downsides with the denture is that they can come loose when you're eating or speaking, and it can make for an embarrassing situation. The other downside is that you will have no teeth or implant there, and same thing, the bone can start to shrink away again, and it might exclude you from having an implant in the future. So the third option we have available to us is the bridge. The bridge is a good middle tier option, especially if you want to have something that's fixed and permanent in your mouth. There are some drawbacks to having a bridge. One of the biggest drawbacks is that you will have to drill into the teeth on either side, and over time these teeth can be lost, especially if you take out a lot for the bridge. The other downside is that the bone, because there's no tooth or implant holding the bone there, the bone in between will also start to shrink away again. So the fourth and final option, and the most ideal option for tooth replacement, is the dental implant. A dental implant is a screw that goes into your bone, and it can replace either one tooth, multiple teeth, or it can even be used to hold in your denture. The option has a very high success rate. It is placed in your jaw so that it's fixed and stable and doesn't move around. The other benefit of having a dental implant is that it stays and can keep the bone there, and the bone will not shrink away over time. While a surgery is involved, it is a minor surgery and most patients can go back to work the next day. If you have any further questions, please do not hesitate to contact myself, Elizabeth, or the team. Our priority is to make sure you have confidence when you're smiling and eating and help you live your best life.